Hi, I'm Dr. Melissa Clark. I'm one of the licensed naturopathic doctors here at Protea Medical Center. And one thing that I and the other incredible physicians here are incredibly passionate about is educating our patients, especially those who are interested in hormone replacement therapy. For a long time, females were told that it's dangerous, it's unsafe, it's not okay to do. And a lot of that knowledge came from a study that was done in the early 2000s, known as the Women's Health Initiative. Now, it's been a long time since that study came out, but it's still to date one of the largest studies that we have on a large group of women that have gone through that menopausal period. What did we do with that information? Is it helpful? What do we know today? What did we know then? There's still a lot of differing opinions on how to interpret that information in that research study. And unfortunately, it can still be kind of the main reference point for a lot of physicians out there. But we've done our due diligence in reading, rereading that study, all of its sister studies, its cousin studies, its grandmothers, everything in between, so that you don't have to. Now, that doesn't mean you shouldn't, because I think it's so important to educate yourself. But our whole hope and our desire is to be here for you, to make those scary headlines a little bit more digestible. You are entitled to make decisions that feel right for you and feel right for your body and for your case. We just want to make sure that you have the best information that we know to date. So here at Protea, if we're working with you and you're interested in hormone replacement therapy, we're going to spend a lot of time talking about it. We're going to do lab work to assess where your levels are. We're going to go through that line by line so that you can leave that visit feeling more educated and empowered to make the best decisions today that will help you feel better as soon as possible, because you deserve to live the most vital life possible, and we're honored to be just even a small portion of that for you. With that Women's Health Initiative study that again came out in the early 2000s, that research was done on different forms of hormones than what we use today. For example, the estrogen replacement therapy that was used is called conjugated equine estrogen. Now, that's estrogen that comes from horse urine. Now, that's not inherently bad or scary. It's just where we got it from. And the difference is that estrogen isn't exactly the same as what the estrogen is that our body makes. So it's kind of like fitting a key into a lock that isn't quite the right shape. It kind of works, but it also kind of doesn't. And the problem with that is that sometimes it can cause inflammation. And also we don't fully understand all the effects that it has on the body because it's not exactly what you would have made. Similarly, instead of using progesterone, which is another female hormone, they used progestin, which is a synthetic form of that. So that study that was done was using those hormones. And unfortunately, some of the outcomes that came from that caught big and scary headlines. One of them being estrogen replacement therapy causes cancer. Now, of course, if you're going to read that, you're going to want to drop your hands, not touch hormones with a 10-foot pole. And I understand that fear. And you're very entitled to want to engage more with that information rather than jumping on a decision really quickly. It's important to have a better understanding of what hormones do in our body and the benefits and the risks that they may carry. So a lot of what we'll do with our patients is walk through that study. Why is it different? One of the main reasons is we use bioidentical versions of hormone replacement therapy. So that means it is the perfect key for that lock. We know exactly how it works. We know what it's going to do in the body, and we know how to measure it in your bloodstream to make sure that those levels are working for you. And also we know what symptoms that it can cause if it's too high or too low, so we can keep you in a nice, beautiful, sweet spot. Because again, you deserve to feel good, and there's a lot of good things that can come from hormone replacement therapy. Again, that scare that came out was relating to breast cancer. Now, the study found that there was a small increased incidence in breast cancer diagnosis. Again, we were using those different forms of hormones than what we use now, but what's even more important to note is that that study had no increased risk in mortality from breast cancer. and it wasn't an absolute increase in risk. So it really ultimately didn't make a huge difference, and it didn't reach statistical significance, which is a big thing that we look for in the scientific literature world. However, it caught headlines, it made a lot of doctors scared of prescribing it, and it took that option away from a lot of women. And unfortunately, a ton of women went through menopause without any support. And when that happens, one of the biggest risks of estrogen depleting as we enter menopause is that our bones get weaker and we have a risk of osteoporosis. And larger than that, that causes an increased risk of fracture. As women, unfortunately, we're more likely to pass from a complication of a fracture than from breast cancer, even though we're more likely to get breast cancer. So for those reasons alone, it can be really helpful to have estrogen replacement therapy in that postmenopausal period. So if you're curious about checking in on your hormones, if hormone replacement therapy may be right and safe for you, or are just looking for some more guidance and a provider that will sit down and talk with you about all the information that's out there, we would love to see you. Feel free to check out our website for more information. Give us a call or a text. We would love to get you on our schedule so that we can have a whole hour together to really dive deep into this and help you feel your best as soon as possible.